Hi, my name is Greg Raab. I'm with Elite Sports Medicine, and I specialize in hip and knee replacement and revisions of hip and knee replacements. Yeah, I grew up sort of in a challenging situation in an Army family, so we moved all over the place throughout the United States and around the world. So that certainly had an impact in my upbringing and some of the things that I was exposed to. But my siblings and I were all active in sports and stuff at school, so we're the typical active family. Actually, right after I graduated from college, I was a high school biology teacher for a number of years, thinking I wanted to go to medical school, but not really knowing specifically what part of medicine I was thinking about. And then I had a sort of a chance encounter with a television show that I was watching at my mom's house over a Thanksgiving break. And the show was about hip and knee replacements. And I just thought, looks pretty cool. That's something I want to pursue, but didn't really know what that meant. So initially in college, thought I was going to go a different route, not in medicine. So taught and then decided, no, I wanted to do medicine. And then it was a challenge of getting into orthopedics, which was a hard thing to do. I graduated from Stanford University in California as an undergraduate, and then took a little hiatus and taught for 4 years, and then went to medical school in Southern California at Loma Linda University. Then ended up doing my residency at the Penn State Medical Center in Hershey, Pennsylvania. Did a year of fellowship in North Carolina at the North Carolina Orthopedic Department. There were several things that attracted me about being here. I mean, we certainly wanted to be further south, like I said, and enjoy certainly more warmer months than ice and snow in Pennsylvania. But once I came here and really met with Dr. Elrod and some of the other senior partners, I mean, I was impressed by the emphasis on patient-focused care and what we talk about around here, that everybody really is a VIP. And thought on the surface that sounds a little bit quirky, but the reality is, I mean, we mean it, and we want to treat all patients sort of with the utmost care and respect, like we would want to be treated. And I think that really was very evident once I started to meet people and interact with the folks here. When you go through a clinic day, yeah, sometimes they can be long and hard, but you see that one or two or third patient of the day that is just so grateful, what you've been able to do for them and with them. When they start talking about things they've been able to do that they haven't been able to do for a long time, that's the part that just becomes extremely rewarding, which is why I think all of us sort of got into medicine for that reason. But it's nice to see that on a daily basis. I really want to spend as much time with each patient as I can. And when you're outside the door walking in, you don't really know what that means exactly. And sometimes that's a very quick visit and maybe 4 or 5 minutes and they're doing fine and there's no issues. And other times it's much longer. And I like to get to know my patients too, and you can't do that in a quick in and out visit. So sometimes we're talking about travel or their family or work or where we've lived, and other times we're spending all the time specifically talking about what their medical related issue is. And so I sometimes warn patients about that, but I think once they understand that I really do that with every patient, try to do that with every patient, they understand that if I'm late, that's probably because I'm spending time talking with somebody else. And then when I'm in their room, I give them the same time or try to, and hopefully that comes across. Thank you for taking the time to learn more about me and about our practice at Elite. You can schedule an appointment with us either by calling or online. We look forward to seeing you.